So I'm Nick Moore, I'm a GP in Portsmouth. I work at Derby Road Practice in North End, and I'm also a clinical executive on the CCG, which is the commissioning organisation that helps decide on how we spend money locally to help improve the services to the patients and the citizens of Portsmouth. I think one of the great strengths of Portsmouth is that we have a really strong sense of identity as a city. We're an island city, we talk about that a lot, and I think that really lends itself to people having a strong sense of identity, and that leads on to sort of a desire to try and work hard for our local residents. I live and work in the city myself, and so it's we're passionate here about trying to make sure that what we do makes sense for our patients on the ground and for improving the health and services that we give to our local residents. I think there's a really strong integration here in Portsmouth between the City Council and our NHS. We all work in the same building, which allows for really good working relationships with colleagues, also from public health, looking at improving the health of our population, things like increasing exercise, reducing smoking, strategies for tackling obesity, and it also helps inform strategies for things like the further plans that we're going to make, or that the City Council needs to make in the future, with things like regenerating the seafront, the new sea defences, how you can improve facilities for people to exercise, and that will obviously improve people's health as well. So lots of things I think are really positive and strong to do, and that's all informed by the sort of strong and close relationships that people have, working together. And what I want to see in the future is that we build on that and really, push on, with an integrated strategy. One of the things that I'm quite passionate about is improving physical exercise. We know that has a massive improvement on people's health and well-being, and so if we can improve access to green spaces, to safe cycle routes, that will improve a lot of people's health. They can obviously exercise and also travel in a sustainable fashion. We're all aware of the impact of climate change and increased amount of congestion. So if we've got more sustainable transport, cycling routes, etc., that's going to improve all of those sorts of things. So and I think that's something that again, in a small city, a small space, we've got a real opportunity to do that as well in the future and build on that. Portsmouth isn't a big place; it's easy to get to. So we need to try and maximise the opportunities that people have to take advantage of the geography that we've been given. From looking at really from a health perspective, I think we need to look at really tackling the rising and things like the rise in rates of obesity and the health outcomes that come from that. And that is really with public health and prevention. So much of what we see as doctors is dealing with problems when they've already come about. And I think as we have an aging population, a growing older population, we're all living longer, but we need to also try and help people live healthier and longer lives. So for me as a doctor, I think the big challenge and one of the big things that we need to look for in the next sort of 20 years is improving people's years of healthy life. And that means, looking at tackling and preventing some of those preventable illnesses. And as I said, with obesity, smoking, those sorts of things are the things that we can really help. And try and tackle and avoid ill health before it comes along. Well, I think obviously one of the other challenges that they're looking at is the A&E department at QA. It was built in 1979. It's an old department. I think there's challenges with trying to manage the flow of patients through the department. They've worked incredibly hard to try and address that, and they've done some great work in the last couple of years. And I think one of the other plans is for a new A&E department, which the Department of Health have given funding for, and hopefully that will enable them to provide 21st century facilities that match the 21st century demand that we're seeing. We've got a fantastic new part of the hospital, but this part wasn't rebuilt when they redeveloped it sort of 10 years ago. So again, that's something that hopefully in the future, if that's delivered, could really improve the care of patients and, say, reduce these waits for ambulances. One of the things that we also need to do is look at stopping people from going to A&E unnecessarily. Sometimes people go there because they know it's a big red building, it's open 24 hours a day, but actually it may not always be the best place for people to go. So one of the challenges we have is to try and make sure that people make the right choices based on their health need, and provide them with suitable alternatives, and also make sure that when we've got patients who are at the end of their lives, maybe frail, elderly, and being looked after at home, that we make sure that as GPs we're providing, and there's a lot of work going on to provide and enhance the care that we can give to patients at home to avoid them having to go to hospital unnecessarily, which may not be the best place for them to receive care. So lots of different things to do with the hospital, providing better facilities, obviously there for people who need to be there, but also making sure that only the right people actually end up in hospital.